Evening students, myself Dr. Pallavi. Today I am going to deal with the topic healing by second union. The wounds which heal by secondary union should have following characteristics like the wound with large tissue deficits, the wound which is left open and the edges of the wound which cannot be approximated by surgical sutures. At times, these wounds are also infected. Now, healing by secondary union is also known as healing by second union. Repair at skin wound consists of three connected processes. That means the processes which happen one after the other. First is inflammation, which is followed by proliferation of epithelial and other cells, accompanied by scar formation. Now we'll see step-by-step process of healing by second union. Firstly, injury causes activation of coagulation pathway, because of which there is formation of blood clot. Now this clot stops bleeding and it also supports the migrating cells. Within first 24 hours of injury, neutrophils migrate towards the fibrin clot. This is the injured part, because of which there is breach in the continuity of the skin, and you can see blood clot here. Basal layer of the epidermis is also discontinued, and towards the blood clot these neutrophils are migrating. By day 3, all the neutrophils are replaced by macrophages and granulation tissue formation occurs. Here is the blood clot. In previous slide there was breach in the continuity of the basal layer of epidermis, but here mitosis occurs and this continuity is again restored. Now all the neutrophils which were seen in the previous slide are replaced by macrophages, and granulation tissue formation occurs, which include blood vessels, fibroblasts and inflammatory cells. Now here I have mentioned neovascularization, because neovascularization means proliferation of blood vessels, which is very important for healing process. Macrophages, which I have mentioned in the previous slide, why it is so important in this process is it clears all the cellular debris, fibrin and other foreign material. It also promotes angiogenesis and extracellular matrix deposition. By day 5, neovascularization reaches its peak, because of which the tissue will appear red in color. Now, the fibroblasts, as they migrate in the granulation tissue, what they do is they proliferate and lay down type 1 collagen and extracellular matrix. In 2 weeks, this extracellular matrix, which was initially having type 3 collagen, is replaced by type 1 collagen, and by the end of first month, scar formation occurs, which is made up of acellular connective tissue and it is covered by intact epidermis. This acellular connective tissue will give the scar appearance very pale. Now, wound contraction. Wound contraction is very important part of healing by second union. It helps to close the wound by decreasing the gap between its dermal edges, and it reduces the wound surface. It also involves formation of network of myofibroblasts. Myofibroblasts are nothing but modified fibroblasts which helps in wound contraction. Now you can see surface area of wound is reduced and the wound is contracted. It is looking pale as compared to the wound which was looking red in color by day 5 of injury. Now if infection is present, what will happen? It will slow down the process of healing. In such cases, we do debridement and remove all the debris part. Things which are to be remembered are, within 6 weeks, large skin defects may be reduced to 5 to 10% of their original size, whereas structures of skin like hair follicles and sweat glands are not replaced in healing by in such wounds.